Welcome to The Explainer. Today, we're digging into a really fascinating study, one that asks a question that could, totally change the future of healthcare. So, could an algorithm really do this? Could it accurately diagnose something as complex as a sexually transmitted infection just from a list of symptoms? That's what researchers are trying to figure out, and it's a huge deal for global health. So yeah, let's dive in. Okay, so before we even get into the AI part, you've got to ask, why? Why would we even need an algorithm for this? Well, to get that, you first have to understand just how massive this problem really is. Just look at that number, over 1 million. That's how many new STI cases happen every single day around the world. That's according to the World Health Organization. I mean, think about that. It means that sexual health clinics are just completely swamped. It's this awful cycle, right? The more cases there are, the more pressure on the clinics, which makes it harder to see everyone, and that can lead to even more cases. And here's where it gets really tricky, even for human doctors. Is that rash, that itch, or that sore, is it actually an STI? Or is it something else completely? A lot of STIs have symptoms that look a whole lot like common skin conditions, and getting it wrong is a big problem. You could end up overtreating someone with antibiotics they don't need, or worse, undertreating them, which means they could pass it on. So, faced with this huge problem, some researchers in Australia had a pretty interesting idea. They thought, okay, what if we could use a piece of software to help with that first step? The sorting process, what they call triage. And that's where machine learning comes in. Now, you've probably heard this term a lot. It's basically a type of AI where you're not giving the computer a bunch of hard-coded rules. Instead, you're teaching it to be an expert pattern finder. You feed it a ton of data, in this case, patient data, and it starts to learn how to make its own connections. And let's be super clear about the goal here. This was never about replacing doctors. No way. The idea was to build a smart sorter, a tool that could help clinics manage that tidal wave of patients much more efficiently by figuring out who really needs to be seen right away. Right, so that all sounds great in theory, but how do you actually do it? How do you teach a bunch of code to spot an STI? Let's walk through exactly how these researchers did it. So here's the game plan. First, they gathered a ton of data. We're talking about more than 1,300 real, anonymized patient records from a clinic in Melbourne. They pulled out 25 key details from each one, everything from age and gender to the specifics of the symptoms. Then, they basically held a competition. They trained 16 different machine learning models on this data to see which one was the best at spotting the patterns. And finally, the crucial step, they tested the winner. They kept 30% of the data hidden and then gave that to the best model as a final exam to see how well it could do on cases it had never, ever seen before. Okay, so the training is done, the test is over. Now it's time to get out the red pen and see how the AI did. Let's look at its report card. So out of all 16 models they tried, which one came out on top? Well, there was a clear winner. The champion model was one called Cat Boost. And check out these numbers. It hit an accuracy of about 84%. Now that means it got the diagnosis right, whether it was an STI or not, more than 8 times out of 10. And at first glance, you're thinking, wow, that's pretty darn good. But as you're about to see, accuracy doesn't tell the whole story. Okay, this is one of the coolest parts. We actually get to peek inside the AI's brain and see what it learned was important. And the number one thing? How long a lesion had been around. The longer it was there, the AI figured the less likely it was an STI. It also learned that things like ulcers and sores were huge red flags, which, is exactly what a human doctor would look for. So you've got this high accuracy, around 84%, and high specificity, which is its ability to correctly spot the non-STI cases, also over 80%. I mean, this looks like a slam dunk, right? Well, this is where things get a little more complicated. Okay, here's the critical trade-off, and this is so important to understand. When you're talking about a public health tool, you absolutely positively cannot miss a serious case, like syphilis. It's just not an option. So the researchers thought, okay, what if we tweak the AI to be super cautious? They managed to get its sensitivity up to 95%, meaning it would catch almost every single STI case. But, and this is a huge but, to do that, its specificity plummeted. It meant that 30% of people who didn't have an STI would be incorrectly flagged as if they did. That's a lot of false alarms. So, all of this brings us to the big conclusion. What's the final verdict on the code? Is this thing actually ready for the real world? And the answer, from the researchers themselves, is not yet. From a public health standpoint, it's just not ready to be a standalone screening tool. That risk of missing even a few important infections, the stakes are just way too high.
But listen, this is not a failure by any means. In fact, it shows huge promise as a kind of co-pilot for doctors. Picture this, a clinician inside the clinic using this tool. It could crunch the symptoms in seconds, offer up a probable diagnosis, and help them prioritize patients way faster. It's a decision support tool.
And that really points to the path forward. The researchers spell it out right here in their conclusion. What was the missing piece? The AI was only working with text, descriptions of symptoms. To get to that next level of accuracy, it needs eyes. It needs to see what the doctor is seeing.
And that's a really powerful idea to end on, isn't it? The future of this isn't just about reading symptoms, it's about seeing them. So as these AIs get better and better at computer vision, you have to wonder, will your next doctor's visit be with an algorithm? It's a fascinating thought. Thanks for diving into this with me today.